I chaired the World Health Organization Commission on Social Determinants of Health, and we described social determinants of health as the conditions in which people are born, grow, live, work, and age, and inequities in power, money, and resources that give rise to inequities in the conditions of daily life. You notice we didn't say much about the health care system, but that's part of the conditions of daily life that impact on health. Let's stand back a bit and say, why do we have a council? What's it doing there? And presumably what it's doing there, and I'm guessing now, if you asked individual councillors, they'd probably say versions of the same thing. They want to create the conditions for better lives for the community they represent. Why else become a councillor? What else are you doing there? And I'm guessing that they'd all say variants of that. Our analysis of the global evidence, and we've repeated it for the UK, synthesizing the evidence, is we've captured that social determinants of health in initially 6 domains of recommendations. Give every child the best start in life, education and lifelong learning. Number 3, employment and working conditions. Number 4, having enough money to live on. Number 5, healthy and sustainable places in which to live and work, including housing, neighborhoods. And number 6, taking what I call a social determinants approach to prevention. So you don't just wag your finger and say, eat properly. You recognize the constraints on people. We've now added 2, tackle discrimination, racism, and their impact, and pursue environmental sustainability and health equity together. So think about those 8. I think that's a pretty good description of the council's span of responsibility. Now, some councils will say we're more concerned with housing, and others will say we're more concerned with opportunities for young people. Fine, have your priorities, but they pretty well all come within our 8, one way or another. Initially, I was quite pleased with the new government's response. They produced a public health white paper, said it was their response to my review. In practice, once they embraced austerity, everything went in the opposite direction. So if we wanted to get action, it wasn't going to come from national government. Child poverty went up, spending on education went down. There's a huge housing shortage, poverty levels rose, the rise of the gig economy. I mean, everything was heading in the wrong direction. And that's not a political statement. That's looking at the things that we know are important for health. So what was I going to do? Sit on my hands and wait till we get a government that might act on this? Coventry, in a way, decided the issue for me. They said, we're going to become a Marmot city. We'll take your 6, now 8, but initially the 6 Marmot principles that I laid out a moment ago, and we'll do them at the city level. So when you ask me, what can the council do? Coventry said, we're going to do all 6 of them. And we won't do it alone. We'll do it with the voluntary and community sector, with the police, the fire and rescue, education, business, if we can get them involved. All the relevant. They set up a Marmot committee, implementation committee, to take the recommendations and work out how to implement them cross-sectorally. So there was a negative and a positive reason for working with regions, counties, places. The negative was if national government won't do it, then maybe county government or city government or whatever will do it. The positive reason is it's much closer to the reality of people's lives. I think elected councillors have a better grasp of the reality of people's lives. This is where they live. It's their people, it's their neighbours. They're representing their neighbours, so they know the issues much more than people sitting some distance away in Whitehall or Westminster. So there was a positive reason. And then there's a question, look, we've got good intentions. We've got a body of knowledge that we've reviewed. But when you implement it, does it work? We want to know, does it really improve people's lives? It's not enough to be nice people with good intentions. Do they work? Well, setting up a health determinants research collaboration is a way of starting to answer those questions. And they're difficult questions to answer. If you want to know, does a vaccine work? You set up a randomized controlled trial. Give half the people the vaccine, half not, and then you see if you get less disease in one group. It's not like this. There's no randomized controlled trial here. This is real life. And trying to figure out if you've made an impact is difficult. It's complicated. But that's what we want the HDRC to do. I get asked, what's the secret to a successful Marmot police? And my response is, first, engage the population for a whole variety of reasons. One, you learn things. You understand the reality of people's lives. But also because it's part of the philosophy, as it were. Don't come and do things to people. Don't be an outside expert and say, I know what's good for you. The involvement is part of the process. Second, charismatic leadership, whether it's the political head of the council, the chief executive, the director of public health, the ICB, but charismatic leadership is important. And third, the involvement, the enthusiastic commitment of the people who are delivering these services. It's got to be cross-sector. As I said before, the voluntary and community sector, other public services, business, but the active involvement of people delivering those services. Well, of course, the NHS has a role in treating people when they're sick. Absolutely. We need universal access to high quality care. But what about the NHS in addressing social determinants? We're working with the East London Foundation Trust, which call themselves the first Marmot Trust. And they say we can influence the social determinants of health. One way is they've taken a report that we did for industry, and they said we can do that for the East London Foundation Trust. Be a good employer, pay a real living wage to the cleaners and to everybody, be a good employer. Think about our service users, our clients, as it were. Are we doing the right thing by our service users? And third, have a positive impact on the community. Be an anchor institution. Think about environment, pollution, purchasing, employment, have a positive impact. And then I'd say, but what about in the particular services? There's been a real rise, for example, in social prescribing. In Liverpool, they write prescriptions to Citizens Advice. The GP write prescriptions to the Citizens Advice Bureau. So people come to their GP and the GP says, you need help from CAB, and they go off. And I said to the Citizens Advice people, look, you can't change child poverty. The Minister of Finance, the Chancellor has to do that. but you could maybe break the link between child poverty and poor outcomes. And they said to me, no, we can change child poverty. We make sure that people get all the benefits to which they're entitled. We help them get back into work. We can actually change child poverty levels. So the NHS, so that's an example of working in partnership with others. So the NHS by itself isn't going to address homelessness. But you know that homelessness is having a big impact on the NHS. Right, let's work in partnership with people who can address homelessness.